we have the great pleasure to have two experts, two digitalization in healthcare experts from Denmark in Switzerland today. And we meet at our Federal Palace. We had an interesting conference. And so it's my pleasure to welcome one of the two experts, Morten Elbæk Petersen. He's CEO at Sundhed DK. That's the company who introduced the electronic patient record. So, great pleasure to have you here, Morten.
Thank you. It's a pleasure to be here.
My first question, we are actually discussing a lot in Switzerland about the electronic ID. Which are your experience in Denmark with this?
For us, the personal ID is very, very important. Everybody in Denmark has a personal identifier, and it's combined with a digital signature. And in Denmark, we used that when we opened Sundhed DK back in 2003 and 2005, because with that, you had the same entrance for all public services and for all private services. So we have the same digital signature we can use for everything.
So you're used to that? It's normal for you? It's regular?
Normal. It's normal, and it's a really important part because it makes people feel safe. It's their own personal entrance. It's very important for them.
And people had no doubt in the beginning, data protection or whatever?
No, because in Denmark, actually, we were quite mature already when we began with the public sector. Before that, we had 10 years of banking, e-banking, so people were quite used to that. Mm-hmm. So we built on that.
Okay. So, as CEO of Sundhed DK, you are, you can say, father of the electronic patient record in Denmark, which is not a promise, it's a success story that exists. So what was the recipe for this success story in Denmark?
I don't know if there are any recipes. I think that people feel empowered because they have access to the same data as the doctor has, so they are more equal now. And the doctors have more well-prepared patients, so I think it's really a win-win. And what is interesting about the Danish e-health record is that it is for every citizen, and it can be accessed by every healthcare professionals, and it is in every healthcare organization in Denmark. So it's really a strong tool for binding together the healthcare sector.
Mm-hmm. And what is the influence on the electronic patient record to quality? There is a strong link between these two aspects?
Yeah, of course, there's a really strong link because nobody wants to make bad data because it's so transparent. Everybody can see what is written and everybody can discuss what is written. So it makes quality better in the healthcare sector, no doubt.
Mm-hmm. And the impact on efficiency?
No doubt. The GP can be in his office and he can see what happened in the hospital, he can see what is happening in the municipality, so he saves a lot of time.
So it's a win-win story?
It's a win-win, no doubt.
Yeah. So, as we know in Switzerland, there are a lot of doubts against the electronic patient record. Which advice would you give us as an expert? What shall we do in Switzerland to make this the same success story as in Denmark?
First thing, today I've been presented for the big program, 10 years program in Switzerland, and you have to move on. You have to make standards, you have to do all the things to break down the silos. But on the other hand, I think it's very important that you ask some users, some patients, if they are more happy and if they are more empowered and if they are more healthy. Because it's the success for the patients that is the really success for the healthcare sector.
So, thank you very much for your visit to Switzerland, Morten, and we stay in contact. Looking forward.
Thank you very much.
Thank you very much.